In 2015, a group of medical experts told parents they should give their infants peanuts starting as young as 4 months. Now, 10 years later, that advice appears to have led to a dramatic decline in the amount of babies who have developed peanut allergies. A new study published today finds that peanut allergies in children ages 0 to 3 years old fell by more than 27% following the 2015 recommendation. That number dropped even more to 40% after the National Institutes of Health expanded on those peanut guidelines in 2017. They included new information about risk factors and testing for infants. Dr. David Hill joins us now. He's an allergist and researcher at the Children's Hospital of Philadelphia. He's also the co-author of the study published today. Thank you so much for being here, Doctor. What is the science behind the early introduction of peanut products?
Thank you for having me. So decades of research have shown that if we expose a child's immune system to food allergens via the gut by having them eat it, it actually reduces their risk of developing food allergies. And that's because we think that the gut can be tolerogenic, is the word, and actually train the immune system to recognize that food as harmless.
So CBS News reports that surveys show only about 29% of pediatricians and 65% of allergists reported following the NIH's expanded guidelines. Why have healthcare professionals been slow to put the recommendations to use?
Well, I think it's natural, of course, to proceed with caution. We did have seminal studies in 2015 that showed that this is safe and effective, followed by the 2015 and 2017 recommendations, as you mentioned. It is important that we get word out now, and that's where this current study comes in, that indeed this is having a positive effect. And the hope is that more and more families, more and more pediatricians and allergists will adopt these recommendations in the coming years.
So today's my first day back at work. I have a 4-month-old. What should I do?
So as long as your 4-month-old is able to eat some solid foods, right, they're developmentally ready for that, then you should introduce the major allergens. You could start with peanut by introducing a small amount the size of your pinky nail. And once you introduce it, you want to keep that peanut butter or peanut product in their diet 3 times a week for up to a year of life to prevent that allergy.
Do you think this method could be used with any other foods? Has it been tested with other foods?
Absolutely, it sure has. So actually in 2021, the guidelines were broadened to include peanut and all of the major allergens. So indeed, now the recommendation is that we start introducing these allergenic foods, again, when developmentally appropriate, between the ages of 4 and 6 months.
Dr. David Hill, thanks so much.
Thank you.